When I grow up to be a man.
What is a man and what does he need to be healthy, especially since he so seldom seems to seek out medical help when he needs it? And what do men need to be aware of as they age? Revealing the life and times of men. The doctors are on call tonight.
When I grow up to be a man.
Funding for On Call Television is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On Call, starting its 11th year of opening doors for important medical information. And by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota. Additional funding is provided by Dakota Care, the Brookings Health System, Dr. Mark Bubach with Dakota Allergy and Asthma, Dakota Dermatology, the South Dakota American College of Physicians, Aberdeen Asthma and Allergy, and Swiftel Communications. Closed captioning for On Call is provided by the generous support of Avera, the Brookings Health System, and Fishback Financial Corporation.
Hello and welcome to On Call Television. Tonight's topic is all about men, but that should not chase away the women or any watchers out there, as most of you you've had to deal with someone of the male species sometime during your day, whether you want to or not. All of us were born from the combination of half male genes, half female genes. We're raised always by a mother figure and a father figure influence. We're sometimes exposed to a brother or a brother-like person. And some of us have sons who challenge, amaze, frustrate, and delight us. I must say, as a father of 3 boys and 1 daughter, I am amazed at the difference in individuals, more than in the differences in their sexes. But still, there is something quite distinct about the male way of thinking. Certainly, guys have a tendency to want to fix things rather than talk about them. Guys would rather cover up any sign of perceived weakness rather than put it out there. Guys want to be perceived by others as tough and strong, starting in those early teen years, and that list of male tendencies can go on. But there are medical problems that are absolutely distinct to men, to include prostate disease with urinary flow problems that can follow, erectile dysfunction, testicular cancer, to name a few. And there are medical problems that occur more often in males, such as early heart attacks, sleep apnea, autism, and that list goes on. To try their hand at your questions, we have 2 great internist friends and guests. Let's meet them.
I'm Dr. Josh Henderson. I'm from Mobridge, South Dakota. I graduated high school from Mobridge, South Dakota, and went on to attend college at South Dakota State University in Brookings. Go Jackrabbits. From there, I went on to attend medical school at Kansas City University of Medicine and Biosciences. Following that, I did my internal medicine residency in Ohio at Northeast Ohio University's College of Medicine. And I've been practicing internal medicine in Mobridge now for 4 years.
My name is Travis Henderson. I am from Mobridge. I went to undergraduate at South Dakota State University. I attended medical school at the University of South Dakota, and I attended an internal medicine residency program at Wright-Patterson Air Force Base in Dayton, Ohio, and now I practice medicine at Mobridge Regional Hospital.
This show is all about your questions. It's your show. You make it interesting. And when the questions come in fast and furious, we often only get to the early calls, so call or email early, please. We will go where you want to go, and we'll do our best to respond, but this is your show and depends on your questions and directions. Please call in your questions, comments about men's health. Call 1-888-376-6225. Or you can submit them at oncalltelevision.com and click on the questions button. Thank you guys for joining us.
We're glad to be here.
Thanks, Rick.
Well, I have to say, your father, who passed away 4 years ago, 7 years ago, was a dear friend and a hero of many people and mine. And I wish he were watching or could have been on the show. But the best thing, the next best thing, is the 2 sons. I'm sure he's proud of the 2 of you. And you're practicing in Mobridge. So, and you're both SDSU grads. And you're a USD grad as well. Kind of one of the same stories that I live. I have to wear 2 hats around here.
Right.
Men's health issues. We can start with that. What do you think you see the most of? And what men's health issue is the first or most common thing that you deal with?
Well, probably one of the most common things I deal with is diabetes and heart disease, and of course those aren't specific to males, but it's certainly prominent in the male population. But then, after that we have prostate disease and
urinary
like
flow
that.
problems.
Right, very common.
Yeah, and your practice is similar to his. Is yours more with older or younger people? I mean, you're the younger of the 2.
I have a good mix. Obviously doing internal medicine, though, a lot more of the older population.
Yeah.
And it's a joy to take care of those people. But yeah, I'm fortunate I have a good mix. So I see some young people and some teenagers, and so they keep things fun.
So while you guys are calling, we want you calling now. Aggressive guy thing, pointing, aggressive, called in your questions. Guys also are less likely to really come into the doctor and express their feelings. I mean, is that something that's just my take on it, or what do you think, Josh?
No, it's a very real thing. It's kind of that there's a macho mentality, and even with the older generations, it seems like they were taught to not complain, about things, or be emotional, or tell people that they're depressed. And so sometimes those are kind of trickier diagnoses. You have to pry that information from people.
Yeah, let's talk about depression in guys. They say that the women are more depressed than guys. I think that depression isn't really depression in guys. It's anger, or it comes out in a different way than in women. Travis.
Yeah, like you alluded to earlier, men tend to internalize things, and they oftentimes won't admit that they're depressed or ask, about depression. And so you have to take clues other than verbal clues from the patient. Maybe it's talking to their spouse or their family, or watching their body language, or watching vital signs. Watch their weight. Maybe they're losing weight because of their depression. So you have to. You can't wait for the patient to tell you there's something wrong. You have to look for it.
Yeah, right. Now you have. Let's see. Now you have 4 daughters,
4 daughters.
right? But you have the boys, 2
Yep,
boys.
2 boys.
So I mean, I'm sure that you guys watch the cousins get a chance to be observed differently. What do you think about the way kids act differently than the boy kids act differently than girl kids? I mean, is that a sexism thing to say, or what do you think?
I think it's pretty real observation. Without really forcing on my kids, my oldest boy was drawn to Tonka trucks, and my youngest to horses and cowboys. So I just, there's something about those things, and
Yeah.
the cousins might just walk by the Tonka truck and they don't care.
They don't care. They're
But
not
they'll
Tonka-
sit down and play with them at times. But it's a different mentality.
Tonka
Absolutely.
trucks and horse toys, no?
No, they do play together on the swing set and riding bikes, but when it comes to the trucks or the dolls, they separate. But I'm just glad that he has boys, because I still get to buy toy tractors once in a while.
Yeah, for
His
somebody.
first gift was a Tonka truck
Yeah.
to my son. So he said he's been waiting a long time to get one of those.
We have a question about exercise and hunting.
What exercises should I do before I go pheasant hunting?
So that's a great question. Travis?
Well, I'm not sure there's any specific exercise you need to do for pheasant hunting, but I think the main thing is to just get in shape. Don't let the first hunt of the year be your only exercise or your only walk of the year. Go out and get in shape, go for some walks, walk up and down some hills. Just try and get ready for the season that way.
Yeah, and I think they all want to. They kind of think I should be doing that. I think they should do it through the year so that they don't have to, oh, now it's getting late summer, I'm going to get in shape so I can be ready. And you've ever had anybody have a heart attack while they were hunting, or any major heart problems in your experience?
I'd never have any patients with heart attacks. I've had some gunshot wounds with BBs, but...
Well, what do you say about gunshot injuries? How do we prevent those?
Well, obviously, I mean, basic hunter safety things like wearing hunter orange, being aware of where the other people are hunting. A lot of people don't wear eye protection, and I've had patients that were shot and they had BBs scattered from their face just right by their eyeball all the way down to their groin. So wearing eye protection is important. You know, hearing protection is something we kind of overlook too. But those are kind of big things, along with, you know, being in condition and not making that your first walk of the year.
Right. That's an important one. Yep.
Another thing to be careful of is just stay hydrated, especially in the early hunting season when it's still hot. Be sure not to get dehydrated. I've seen several hunters come in to the emergency room with kidney stones, and you don't want to get dehydrated, especially you know, older people who are more susceptible to dehydration. And another thing is, unfortunately we see quite a bit of in the emergency room is hunters who have partaken in too much alcohol, and you know, just do, you know, stupid things like fall down the stairs afterwards because they, you know, go out to dinner after the hunt and drink too much. And so drink more water and less alcohol.
Yeah, a glass of water between each glass of wine,
right,
or beer or whatever, and not too many of those. Well, testosterone, important for maintaining muscle bulk, adequate levels of red blood cells, bone growth, a sense of well-being, and sexual function. But what about when we have low testosterone? We care very much about maintaining proper levels of this hormone, as low testosterone potentially undermines our very manly essence and well-being.
Testosterone is the major male hormone, sex hormone that the body produces. It is something that gradually rises and then increases at the point of puberty into adulthood, and it's very important for many functions, including maintaining a sense of well-being, bone and muscle mass, sexual function, and overall vitality and vigor of a gentleman. Sometimes it can be difficult for a patient to know that they have low testosterone. They might consider it just part of aging, feeling more tired, depressed, fatigued, but typical symptoms would be loss of stamina, weakness, lack of energy, difficulty with libido, sexual function. Testosterone certainly has become a more hot topic in recent years, and I think a lot of this is driven by several factors. First of all, I think people are more open to discuss issues such as erectile dysfunction with their physician, and that might be more likely to prompt testing for testosterone. In addition, I think having the baby boom generation, which wants to maintain their vigor, health, and vitality, are a driving force in terms of testing for low testosterone. And finally, perhaps one of the biggest contributing factors are the proliferation of commercial advertising with new preparations, these new testosterone gels, which has prompted people to say, maybe this could be me. The treatments are a variety of different forms. Most likely they represent injectable testosterone or transdermal patches or gels. There are pills that are out there, but we don't recommend those. If taken as an oral ingested pill, that may have damage on the liver and actually lead to liver tumors. So testosterone is best given via injections. There is a form that you can do within the inner cheek or gum that doesn't go through the stomach or the liver. And then finally, these gels or transdermal patches, and there's a variety of ones that are available for that. Testosterone via injection or gel is synthetically made, but is an analog of what humans produce themselves. It works effectively and it will achieve the desired range. Target ranges are typically somewhere between about 400 and 800 as a value for testosterone. Sometimes I'll get the question where people will ask, what if my levels are normal and I were to take testosterone supplements, would it help me? And the general answer is that no. Typically when you start using a testosterone gel or some other exogenous form, what will happen is it'll turn off your brain hormones of FSH and LH and thereby inhibit your own testosterone production, and in a sense it's a wash. Your levels really will not improve, and in doing so you may lead to testicular shrinkage as well as loss of fertility, decreased sperm count, and so it is not recommended to use or abuse testosterone replacement therapy if you don't need it.
Interesting information about testosterone. Please call in your questions or comments on 1-888-376-6225 or submit your call or questions to oncalltelevision.com. You know, he talked about libido and then he talked about erectile dysfunction. What's libido versus, what is libido?
Basically your sex drive.
You know, your interest.
Right.
So libido is that drive. So erectile dysfunction is?
The inability to get an erection.
Right, so those two things, if you're not interested, doesn't matter. If you're interested but the erectile thing doesn't work, then that's a problem. So let's talk about treating those things. Testosterone for one. What about it?
Well, the interesting thing about testosterone is that as men age, testosterone levels decline. And as men age, we also develop a lot of symptoms that we call aging, such as loss of energy, loss of muscle mass, osteoporosis, depression becomes more common, various other things. And we've also observed that in young men who have low testosterone levels because of pituitary disease or testicular disease, they develop some of these same symptoms of aging. So there's you know, the thought that low testosterone may be
just
a
normal
cause
aging.
of aging, yeah.
Or it might be a cause of aging.
Right, could be the chicken or the egg. And so when you look at replacing testosterone in middle-aged and elderly men who have low testosterone, you know, we wonder, does it reverse some of these age-related changes or symptoms? And there is some evidence that suggests that it does.
Yeah. And so so I do have a number of older guys. They come in and they go, well, you know, I'm kind of wanting to be still active down there, and so why don't you just get me some? Or I've got these pills that I've got, or these herbal things I've got. What would be the next step to do if a patient comes to you with that question, Josh?
So the next step is to check their serum testosterone level. It's recommended to check the total serum testosterone, and you're going to look at a certain value for a cutoff, and if they're kind of below that range and they have that constellation of symptoms, you know, decreased libido, decreased energy, depressed mood, things like that, and then clinically they may have anemia or osteoporosis and these type of things as well. So if they're fit that category, then you know they'd be a candidate for testosterone replacement therapy.
Right. So there's a bunch of, what about these things that you can buy and they send them to you in the mail and they're saying, you know, if you're sexually without the energy and so on and so forth, there's this herb and then there's this supplement and so on and so forth. Any valid supplement that can give you some sexual kick?
You know, most of those things that you buy on TV or see in magazine ads are not validated. You got to be very skeptical of that, and I generally don't recommend those kinds of things to people. They're not proven. The safety of those things is not always known, and so in generally, if they sound too good to be true, they probably are.
And there are people out there to take our money,
right,
and give you nothing in return. And the data on those things is that they can vary. If they do have any kind of supplement that had anything to benefit you, you don't know that it's going to be there in one pill to the next. And there's a danger that it could affect your liver if you're taking it in that manner. So we've got all these topical things going on right now, which is quite interesting. But the price of testosterone supplements is very high, right?
Right.
Yes.
Except for the injections. I checked on the injection, and some people don't like injections, but let's look at it this way. The injection is a long-acting testosterone, lasts about 2 weeks, so you take that shot twice a month. It's about $12 per injection if you buy a 10 milliliter bottle. And if you get a 1 milliliter bottle with one injection, it's like $33 for one injection, so it's like $66 a month, whereas it could be, it's about $12 an injection if you buy the big bottle. So that means $24. If it's covered by your insurance, it may be a lot less than that, versus $300, $400 worth on the other kinds. But some people want the other kind, and there you have it.
It seems like a no-brainer from the cost standpoint, but the trick is convincing patients that you want to do the shot, and getting past the thought of that is a tricky thing sometimes. And I have patients they've trained their wife to give them the shot, and things like that. But that's the most common treatment of testosterone replacement that I have. Most patients are doing the shot, and it's simply from a cost standpoint.
Yeah, there are, by the way, compounding pharmacies. There's one in Sioux Falls that you can do a testosterone, same testosterone that's in the injection. She puts it in a gel, you do the gel once a day, and it's something like $60, $80 a month. So there's that option to talk to your physician about. Well, we've got another question.
What about male menopause? Is it a fact or a myth?
Right, that kind of ties into this. Do you think male menopause is really a reflection of the dropping of testosterone? Or do you think it's a real deal?
Well, I'm not sure, but there have been studies that have looked at these symptoms of aging, and they've associated those or compared those to large groups of men, and they've looked at their testosterone levels, and there does seem to be a small subset of men with very low testosterone levels who consistently have low energy, anemia, osteoporosis, low libido, and so that suggests that there is maybe a male menopause or whatever you want to call it, but it's actually a pretty uncommon, that category of testosterone levels includes a very small percentage of the population.
We do have one question from Beersford, 27-year-old male with narcolepsy and low testosterone level. Would increasing the testosterone help? Josh?
Possibly. I mean, there's
something else happening here.
Yeah, narcolepsy is a whole nother situation, and that's treated sometimes with a different whole line of medications. Does he have low testosterone?
I think he does. So it makes me worry there's a pituitary or a brain thing.
That would require a little more investigation. Right. Absolutely.
I generally do a thyroid test and a B12 test with these people, and I also look at pituitary function, other pituitary things to make sure that it isn't a brain or pituitary abnormality when there's low testosterone. But it's not an extensive workup.
Right, especially in a young man. Low testosterone in a young man is a different ballgame altogether than a middle-aged and elderly man.
Sometimes you call the endocrinologist on that one.
Right.
Physical strength and aggressiveness seems to come naturally to men. It can be a great asset in sports, but it does not fit as well in everyday life. Aggressiveness in women is different, however. Their aggression can be just as forceful, but in a different way.
If you take young boys or preschool kids and you look at girls and boys, the girls are much less aggressive and much less sort of likely to hit each other and so on and so forth. You move into middle school and boys become totally squirrely and they hit puberty and they get much more hormonal. The girls, when they get hormonal, usually are much more emotional and get sad and cry and spontaneously just out of the blue, you can't figure out what's going on. They're much more verbal with their aggressiveness, and it's likely to be not acted on physically. Guys, are more likely to get physical with their aggression when it's there, and they're, all the way through life, men have a tendency not to be as skilled and as facile with language as women are. So frequently in relationships, the women can always win the verbal battles, and the men end up, having greater strength. And it probably dates back to prehistoric times when we were in caves still. I would guess, I think the idea of, so you have to prove your turf by a fight, I think is not a typical sort of, territorial, limits and how wide do you spray, the region that you're in charge of, etc. And the girls don't have that. Women, I don't think necessarily, they have to go through a different initiation, and I think it's probably verbal stuff.
That's so interesting. Marty, the psychiatrist friend of ours, we grabbed him and interviewed him, and he said that there are all these clear-cut differences between guys. Did you agree with everything that he said?
Yeah, I think for the most
It was
part.
pretty accurate, yeah.
The women are more verbal than guys. I mean, they really, in general, they are, aren't they? Although you'll get a chatty guy, and you get a quiet woman. Mm-hmm. So, I mean, there's an awful lot of overlap.
Right.
So we're not totally saying all those are exactly the way everybody is, but there's tendencies. Additional note on hypergonadism question. Here's the hypergonadism question in Rapid City. Caller had a excuse me, vasectomy, hernia surgery, and a while back and developed hypergonadism. What could be the cause? Excuse me. Hypergonadism. Vasectomy, hernia repair. So large testicles. I'm thinking it could be a cyst that occurs in the scrotum that many people will have, and it's a benign thing, and you generally leave it alone until it's too big to move around with. The second question is, he's had 2 needle biopsies of prostate. Are there alternative measures to do the biopsy, and what is your opinion of a prostate biopsy?
Good question.
Yeah.
Have you had a prostate biopsy? No, neither one of you have. I haven't either. I'm not looking forward to it. But it's certainly something to consider if you think there's cancer.
Right. Yeah, the prostate biopsy is usually the first step that is taken after a man has been found to have an elevated PSA. And the PSA is the prostate-specific antigen, which is the blood test that we use as a screening test for prostate cancer. And usually the usual scenario is if a man comes in for an annual physical and it gets a PSA and it's found to be high, he will be referred to a urologist, and that may lead to a prostate biopsy. And the purpose of the prostate biopsy is to find out whether or not the high PSA is caused by prostate cancer or some other condition. And they can be an uncomfortable procedure, and I don't know of any other way to really diagnose or rule out prostate cancer. It's the best test that we have right now.
Thing.
Well, tell me about PSAs. There is a lot out there about PSAs, and it is we're hearing all sorts of different advice out there. I mean, what's the take-home message, or what would be, when should a person actually have a PSA, or should they ever have a PSA? Josh?
I think most societies agree starting the PSA testing at 50 years old is one of the few things everybody agrees on. It's kind of one of these topics where there's a lot of variability between different medical societies and how they're approaching it. I think it's one of those things where everybody agrees to disagree a little bit, but technically you start at 50 years old with the PSA test. It's not a perfect test, it's just a screening test. And over the course of a person's lifetime, a male has like a 16% chance of developing prostate cancer, but only about a 2.5% chance of actually developing or dying from that cancer. And of the people that do have the elevated PSA tests, only about a third of those actually have prostate cancer. So it's kind of an unsettling thing for a person to be told that your PSA is elevated, we need to see the urologist. But I kind of remind them that too. It doesn't mean you have prostate cancer. It just means we need to do a little bit further workup.
You echo that?
Right. Yeah, he touched on an interesting point that prostate cancer is very common, but death from prostate cancer is fairly uncommon. So most men who have prostate cancer are not going to die from it, and a lot of them probably will never even develop any symptoms from the prostate cancer. So therefore, they don't need to be, not every man with prostate cancer needs to be treated, and probably doesn't even need to have their prostate cancer diagnosed. The problem is we don't know which men with prostate cancer are going to have the aggressive cancers that will threaten their life, and which men with prostate cancer have a more less threatening prostate cancer, and therefore don't need to be treated. And we have some tools we use to give us a rough idea who needs to be treated and who doesn't, but we're not very good at it. We don't have a very clear crystal ball. And so the other dilemma is that we end up treating a lot of men for prostate cancer who may not need to be treated.
And there's side effects from the treatment.
Right. The treatment isn't perfect.
No, well, sometimes you lose your sexual function, and sometimes you lose your urinary continence. I mean, you leak. And I mean, for that reason, that the treatment is not great and can have side effects, that the majority of the people who have prostate cancer aren't going to die from it, and that our test is so lousy, then there is at least one organization said, don't test. And you can understand that. And I think the ACP says if you're going to recommend it, you need to make sure that you've told them that so many of these people don't die of cancer, that these are the side effects of the treatment and even the diagnostic treatment, and that that the test is a crappy test anyway. That there are people who don't have cancer that have elevated prostate specific antigens, and then there are people who have a normal PSA and they do have cancer, and it's not a very good test. So we're in a dilemma, aren't we? So I share with you. But then what do we say? Well, maybe you could have it done at 50. You said recommended at 50 and every year or so after that. I'm saying I do a rectal exam. People say about the same thing on digital prostate exams, but yeah, I also get a stool for blood with that digital exam and look for colon cancers. And I do that every year after 50. I'm not sure I'm doing PSAs. So we could agree to disagree, but.
Right. You have to talk it over with your patient and explain the risks of testing with a PSA and the benefits of testing a PSA, and let the man decide. And it depends on a lot of things: his preferences, his health, his age. It doesn't make sense to test a very elderly man who has a lot of health problems and probably won't, may not live very long. It doesn't make sense to test that kind of person for a disease that may take 10 or 15 years to even cause symptoms.
Right.
Whereas a younger man,
maybe.
Right.
Certainly not after 70, isn't that what they're saying, though?
Yeah.
Certainly not after 70. I've been using it as a non-screening test. In other words, if I suspect prostate cancer, I'll check a PSA. And if it's normal, I'll feel reassured. If it's abnormal, I don't know what to do, but maybe it is prostate cancer, and I'll do other tests. Definitely a difficult area, and people want to know the answer, and they look to us to have great answers, and we don't have a great answer in this one. Caller wants to know the proper ratio of protein carbohydrates to lose weight. What would be a good diet to achieve weight loss? And I'm sure it's a man asking that question, but it should work for women too. What would be your recommendation about weight loss? Josh?
There's so many different diets out there to follow, everything from the Atkins to other things. And, the bottom line to losing weight, no matter what you do, is you've got to be burning more calories than you're taking in. I mean, that's the bottom line. That's the basis of any kind of weight loss. And so, is there any one plan that's better than another? No. I mean, and everybody's different in what they can endure. And I usually tell people, you need to make subtle changes to your diet that are sustainable, things that you can do the rest of your life and maintain. If it's something that's radical, that you're doing just all protein all the time or all this or that all the time, you're going to get tired of it, you'll get burned out, it's not sustainable. And so that's an important part of any kind of diet, it's got to be something realistic that you can do. And I think most of us aren't as active as we should be either. Exercise is always a tremendous way to augment weight loss.
Yeah, I agree. Add to that, Travis?
I agree with him. I try to impress upon people to just use common sense. I don't ever recommend specific diets to people. I just say, try and limit your portions. Think about how big a pile of mashed potatoes you put on your plate, and ask yourself if you really need that big a pile, and make it smaller next time. Limit your portions, limit your snacking, and exercise as much as you can.
And most people don't get enough fruits and vegetables in their diet. I mean, you should have, they say, about 5 servings a day between the two. So if you're sitting down at mealtime and you're still hungry, maybe have a second helping of vegetable or the fruit, and you might actually meet your goal of fruits and vegetables for the day. And you're filling up on something that's nutritious and not something that's not.
Music to my ears. Perfect answers, I think. We've got Joe over here, and actually Joe's got body parts that we could analyze if anywhere along the line we want to jump in on that particular part. Here's, Joe doesn't mind, really doesn't mind. Yankton, 45-year-old person, when should someone get a herpes vaccine? Boys after age 11? Herpes, zoster, shingles vaccine, what do you think?
It's now approved for down to 50 years old. It used to be 60.
Mm-hmm.
So
I'm pushing it for 60 and older.
Yeah.
Mm-hmm. And it'll be more and more covered.
Yeah, it is.
It's approved to 50.
Pretty well covered.
Yeah.
Yep.
It wasn't covered when I got mine. They covered it right after I paid the $200 and some. So caller's husband, age 61, has metabolic syndrome. If he doesn't change his lifestyle, when can he expect to develop diabetes, and what other complications may arise? So let's take metabolic. And is he there watching you? Are you with him? Think about it, guy. Are you mad at her for asking this great question? So thank you for the question. What is metabolic syndrome?
Well, the metabolic syndrome is a complex of characteristics that basically describe people who are at risk for developing diabetes. It's central obesity, high blood pressure, and elevated fasting glucose. And
so high blood sugar and central obesity. Now, what's central obesity? What's the difference between the other kind of obesity?
Well, everybody's shaped a little bit differently, but there are kind of some general body types. And some people carry a lot of weight in their abdomen. Some people carry a lot of weight below their waist. Some people's extra weight's just kind of distributed everywhere. But the people who tend to carry more weight in the abdomen or have more abdominal fat are the people that we call metabolic syndrome, because those people tend to have a higher risk of going on to developing diabetes.
And those are the apples versus the pears, as they say.
Right.
And they're more often the guy. And the interesting part of the apples is it's easier lost than the pears. Pears can't lose the weight. You got to be darn sick to lose weight. Apples, you can lose weight, but apples are way more dangerous than pears. So can he expect to develop diabetes? Do they all get diabetes?
Probably not. But if you look at that, if you look at people who have that constellation of features, those people are definitely more likely to get diabetes than people who don't have those features. So someone like this person should be very careful about watching his diet, watching his carbohydrate intake, and try and get some exercise at least 5 days a week if possible. Go to your doctor, make sure your blood pressure is under control, make sure your cholesterol is under control, make sure you're getting your blood sugar checked regularly to make sure that you don't develop diabetes.
Any other major complications besides diabetes for these metabolic syndrome people? I mean, the dangers of metabolic syndrome. High blood pressure and stroke, I guess.
Right, yeah.
All right. Ty, okay. Diminished hearing is not a mute matter to you or the people that you come into contact with. It can occur at any age, but is often a product of our bad habits growing up or our past working environments.
Well, most of the time it's family members that direct a patient to come in and get their hearing tested because they're not hearing them, or they're asking them to repeat questions, or saying what or huh a lot. Those are signs that there's probably a hearing loss in a spouse or a family member or a friend. So they usually get some encouragement from others. Whether they take that encouragement or not is another question, but they should. If they don't think they have a hearing loss and somebody tells them that they do, they probably do. And it takes a test, an audiogram and a test, visual inspection of the ear canal, make sure it's not something simple as wax blocking the ear. If it's a clear ear canal and you do an audiogram test and they have a loss, well, they probably have a loss. There's other types of tests that we do, word recognition tests, speech reception threshold, how loud does it have to be before you get some words right. Average level of speech around 60-65 dB. And if they're not hearing words like baseball cowboy at that level, then they've got a hearing loss. You need to go to a licensed dispenser or audiologist in the state of South Dakota, or a medical doctor who specializes with hearing problems and hearing aids. Those are the three gateways to hearing loss care in the United States, is medical doctors, otolaryngologists, audiologists, or hearing aid dispensers. They'll generally show you the results and make recommendations based on the type of hearing loss that you have, because they're all different, like a fingerprint. So they're not all the same. So every one of them has to be tuned a little bit differently for the patient. And that's probably the art form of fitting hearing aids, is not all two patients are the same. The statement I use is, if I can't fix any problem I don't know about, so you need to come back and tell me what the problems are, and I can usually make adjustments. And there may be 4 or 5 issues that you may have with your amplification that takes one adjustment to fix. There may be one issue that takes 5 adjustments to fix. You never know with each patient, and they're individualized. So being able to return for visits to where you were fitted with your hearing aids is critical to success. The baby boomers in particular are coming alive with hearing problems from all the noise exposure that Jay and you and I went through with bands, rock bands. And just now we're starting to see that damage show up in hearing losses. There were some studies that thought that wasn't going to be a problem. Now there's studies saying it is going to be a problem. So a lot of my practice is younger people, and what I mean by younger, I have to be careful when I say this, is 50 to 65 years of age. Those people understand technology and are not afraid to take care of their hearing loss by wearing something that will benefit them. They'll wear a big Bluetooth beetle on their ear and think it's a status symbol. So wearing a hearing aid certainly shouldn't be an objection to those patients.
That's very interesting stuff about hearing loss and hearing aids. You guys, how's your hearing? Too much noise when you were in the Air Force?
I have a little bit of hearing loss in my left ear, and I was told that was probably from hunting, from shooting a shotgun. If you shoot a shotgun right-handed, your left ear is exposed to a lot of noise, and that may be what my problem is.
Yeah. Do you have a hearing loss?
Not so far, but
Yeah. Are you hunters?
Mm-hmm.
we are, yeah.
Yeah. That's such a great sport. I mean, I'm a pheasant hunter. I love to hunt pheasants. And I have taken up the habit of putting those orange plugs in. I can tell you, I see a lot of older farmer guys before they had cabs who have noise exposure induced hearing loss, and they lose the ability to discriminate between voices in a crowd. That's the biggest thing. Tell me more about that.
Yeah, I agree. I think, in that generation, like you said, the open cab, exposure to extremely loud noises. I can relate to that. I have an old tractor, and when I'm riding it, it's very loud. I have to wear very secure hearing protection, because if you do it without it, your ears ring afterwards. So yeah, I mean, it's a very real thing. For the younger generation.
What kind of tractor?
It's an International.
An International. So what was that? It was a John Deere 1-cylinder? Pang, pang. You remember those? Anyway, go ahead. 2-cylinder. I don't know what it was. But anyway, go on.
As far as younger people go, you see a lot of people walking around with their iPods and their music in, and so I think that's probably something to keep in mind and watch the volumes of, because that's probably going to be a more common cause of hearing loss in this generation.
If you can hear the music from your kids' earphones, you know it's too loud.
Right.
Anything to add on that, Travis?
I cringe every day. My daughter walks around the house when she's getting ready for school in the morning with her iPod. Actually, she doesn't use the ear plugs. She just has the noise or the sound coming directly out of the device. So it's not that bad. But I can hear it through the bathroom door with this little iPod.
Yeah.
And I'm just glad she doesn't have them plugged into her ears, because I think that would be much worse.
I think we're going to see a fair amount of hearing loss in that group that's going through it right now. All the earphones and all of the video games, and they're not outside playing like they should be. Here's a caller from Tyler, Minnesota. Go Tyler, Minnesota. Thank you for that. The caller had a son who was born with a hernia. It was repaired at the age 5. At 15, he had only one functioning testicle, and he died at the age of 32. I'm so sorry. Prostate cancer after 4 months of chemo, is the cancer related to the hernia and the surgery? It's an unusual story, isn't it?
Yeah.
Do you think it might have been an undescended testicle, or?
Yeah, I'm not sure how someone could get prostate cancer at an early age that would be related to a hernia. So I do wonder, like you said, occasionally boys are born with without both testicles descended out of their abdominal area, and that puts them for some reason at risk for testicular cancer. So I wonder maybe this wasn't testicular cancer instead of a
and that's the
prostate
age group that gets affected by it. 25 to 35 are the people who get testicular cancer. So.
Right, okay, now here we go. I'm going to jump in and hold up naughty parts or whatever. You know, you can do this when you're a doctor, right?
Right.
But I'm just trying to think that the testicle, which is down in here, is undescended. I don't know which is camera 3. This one right here. So the testicle is in the groin, in the, where the hernia would be. It didn't come down when they were born. It was held up there, and so it stays too warm. The reason they're down in the scrotum is to cool down. In the whole game of things, you need to have the sperm need to be cooler than the body would allow. But apparently, if it's kept inside, well, you tell the story. If the testicle is kept inside, the risk of cancer.
Right, it goes up. You know, I don't know what the percentage is that's related to it, but and I don't know if that's related to the testicle being too warm or what. But like you alluded to earlier, the testicle anatomically is supposed to descend and be lower, keep it at a temperature that is lower than normal body temperature for proper spermatogenesis.
Right, and sometimes these people with undescended testicles have cancer, and maybe that's what happened here. Although you don't know. Prostate cancer in a young man at 32, very unusual. Very unusual. I wish I had a better answer for you. Here's a question. My emotions rise and fall with my testosterone shots. Is there a way to counteract the effect?
Well, the testosterone injections, they basically give you a big dose of testosterone when you get the shot, and then it slowly dissipates over the next couple of weeks or so. And so the testosterone levels tend to rise right after a shot, and then they fall after a couple of weeks, as he's saying, and that can, the man can notice that. He'll feel different when he has a higher level of testosterone than he does a few days later when it wears off. And so the way to get around that is sometimes you can give your injections closer together, maybe a lower dose but more often, so there's not such a wearing off, a noticeable wearing off period. Or another option would be to go to a different type of testosterone treatment, such as one of the patches or the gels, right, which are dosed every day, and then you don't have these big swings in testosterone levels.
Gradual release that's more steady.
Right. And if you could handle a shot a week, do 100 milligrams every week instead of 200 every 2 weeks. I used to give 400 every 4 weeks. So I've gotten into the 200 every 2 week protocol. I have a pancreatitis 3 times this year. They don't know what's the cause, what could be the cause. Lovastatin for cholesterol, could that be the cause?
Well, there are a lot of reasons people can get pancreatitis, and unfortunately there are some people who get what we call recurrent pancreatitis. In other words, they just get it frequently, and we usually can't find a cause. The list of medications that is thought to cause pancreatitis is extremely long and is growing every time I look at it. And if I don't know if lovastatin's on that list, but anything's possible.
It is. I agree with you. We'll be back right after this.
When you smoke, so does your baby. If you smoke while you're pregnant, you're putting deadly poisons into your blood. The same blood you share with your baby. It can damage baby's lungs, cause premature birth, underweight babies. Plus, babies of moms who smoke are up to 3 times more likely to die of SIDS. Please, quit before it's too late.
Is it fair to make certain generalizations about men Do men always try to fix what's broken, and will a guy always try to deny or cover up his problems or his symptoms? I submit a real macho, manly man can best fix problems if he doesn't cover up. The Spanish or Portuguese word machismo refers to an old world belief in the supremacy of men over women, something rightfully criticized by modern men who strive in all ways for justice and equality. In contrast, the word macho is a modern derivation of the old word, which should refer to male pride for admirable actions, being forthright rather than covering up, proving gracious rather than being passive, valuing others rather than demeaning others, showing confidence rather than in-your-face aggression, protecting others rather than putting the weaker at risk. The new word macho is not the opposite of femininity, rather a unique male balance of human traits, including compassion and justice. And yes, he still tries to fix problems. But where does this macho man come from? Of course, growing up, he hopefully learns from a protecting father, role model, and an ever-reassuring mother. But also, what makes the man is also an almost magical power of certain testosterone and estrogen hormone levels, starting when the male fetus is within the uterus, and just the right balance of these hormones continuing all through that fetus, then boy, then baby, then boy, then man's life. It's almost poetic to learn from recent scientific studies that even male sexual drives comes not just from testosterone, but rather from the right blend of testosterone and estrogen. Experts say the male body makes estrogen from testosterone. Who would have guessed that maleness is all about a balance of hormones, including estrogen? Recently, we've discovered that some men, for various reasons, have low testosterone and thus low estrogen levels too, sometimes resulting in fatigue, weakness, depression, and sexual dysfunction. It's nice to learn that treatment with inexpensive testosterone shots or more expensive creams, gels, or patches return most men to normal. And again, the body turns some of that testosterone to estrogen, making the correct balance. Alas, too many men are old world and have a tendency to deny and cover up those symptoms. Come on now. A real macho man would have the simple blood test to make the diagnosis and set the stage to fix the problem. Any comments about that dropping percentage of testosterone? Is that normal? Should we replace it always? Should we allow men to age and let some of that testosterone wane a little bit?
I think its dropping is normal. That's a normal process of aging, just like every organ and system in your body slowly declines as you get older. And so depending on a person's individual situation, symptoms, and blood tests, they might be a candidate or they might not be for testosterone replacement.
See what they feel like. We got about 30 seconds. Anything else, Travis? Take-home message you want to share with the people?
I think a big topic is prostate cancer screening. There's a lot of controversy and debate on that, and there's no right or wrong answer. What I would tell the viewers is to talk to your doctor about your situation and your preferences on prostate cancer screening.
One last word.
I liked your bit on balance at the end there. I think you should find a balance in your life between your work life, your home life, exercise, balanced diet. I mean, it goes a long ways towards prevention.
There we go. Well, this brings us to the end of our show this evening. I'd like to sincerely thank our studio guests, the brothers, Dr. Josh Henderson and Travis Henderson, a word for Ben, for helping us. Oliver Wendell Holmes pointed out, men do not quit playing because they grow old. They grow old because they quit playing. Until next time, stay healthy out there, people.
Funding for On-Call Television is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On Call, starting its 11th year of opening doors for important medical information. And by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota. Additional funding is provided by Dakota Care, the Brookings Health System, Dr. Mark Bubach with Dakota Allergy and Asthma, Dakota Dermatology, the South Dakota American College of Physicians, Aberdeen Asthma and Allergy, and Swiftel Communications. Closed captioning for On Call is provided by the generous support of Avera, the Brookings Health System, and Fishback Financial Corporation.